almost fibrosis and fuse, between 20 and 35 years old, depending on the person and on their sport and their genetics, all that kind of stuff. The mobilisations that we do are not very specific. So you can do any of them and get some kind of glide or a movement. I wouldn't mobilise at the proximal end of the clavicle to get a distal or an AC joint result, and vice versa. So wherever you're going to be on the clavicle, that's going to be the joint that you're after. But we can't say if I do a superior glide that I'm going to get more or greater shoulder extension, because it's such a small glide that we get, because we're getting mainly a rotation. We don't really get glides as such, that we can pretty much do any of them and get a good result. So if someone's really tight in pecs, maybe you wouldn't do anything that's going to press on that, but you would come from the top and do a different technique. Just depends. You'll also find that to open up our clavicular rotation, you're going to get much better results from treating pec major fascially and subclavius, and the fascia through scalenes, and even upper trap, so that anterior triangle, than you will from doing a mobilisation technique. Okay, go with that as you will. So we've got AP, PA, inferior glide and superior glide for both SC and AC. They're both done on the clavicle. We don't come across onto the sternum or onto the acromion. We just need to make sure that we're on that point. I'm literally going to show you all four and then all four, because it comes down to practice and getting your thumb into the right position, and it will be how painful it is for the person. So palpating along the clavicle and along that manubrium to find that little divot, which is your SC joint, and I'm going to come just lateral to that. Okay, not a centimetre, a millimetre or two at the very most. So for my superior glide, because I'm already standing in this position, find your clavicle, roll a flat thumb, not a pokey thumb, a flat thumb, and then support thumb on thumb. And I'm going to glide superiorly, so cephalad towards the head. Making sure that my fingers are not near throat. If you have to be in that position, just tuck your fingers away, whatever that means. So proximal end, or medial end of the clavicle, roll, thumb on thumb to support, and a superior glide, so going towards the head. And inferior glide is the exact opposite. Turn to the right for me. So you just want their face out of the way so that I can come in on that angle, because their chin is going to get in my way. So finding your joint again, coming, sliding with a flat thumb on the superior edge of the clavicle. I'm going to come over your face a little bit. Thumb on thumb, being cautious of where your fingers are, tuck them away if you need to be. And then an inferior glide, so towards the feet. Okay, I'm not digging in with my thumbs and pushing like that, it's going to be too tender. So that's superior and inferior.